Hi, I'm Hillary Raimo, and I'm sitting here today with CEO of AEVOLVE, Rogelio Santos, and we're going to be discussing his company and a lot of other interesting things. Rogelio, you were 8 years old when you learned how to program.
Yes.
Talk to me about that. What was that like?
The experience was very simple, actually. When my mom came home one day, and she was actually learning to program herself. And I watched her do a code, and it was 10 print hello world and 20 go to 10. And you actually watch the hello world repeat from the screen. And at that time, I remember the emotion that I had. It was, you're telling me I can control this two-dimensional screen, which I spent so much time watching. And that excitement from a kid was, I can actually control my world. Everybody watches this thing. I watch this all the time. And so from that point on, I learned this very simple language called BASIC. My dad came home one day, he was working with software from the garment industry, and he had a project. And I simply learned to code over a summertime while there was no school.
Simply.
I don't know what to say. It's hard to explain it. It's hard to explain it because it was a new thing. It was no different than a video game that was presented to a kid or a puzzle, except that you can make a game or you can make something appear on your screen, and that's how it started.
So video games got you. How did the digital part of your life, what did that look like before you became a programmer?
Well, actually, that was, at the time, coding was, programming, like games and programs were very, very simple. You could actually press Control Break, and you could actually see the software, and see the actual code. So I learned to code by looking at other people's games. I would just stop games in the middle.
So here you are, 8 years old, and you're learning how to program, and your father gives you a challenge, and you rise to this challenge. So explain how that process was for you. What was that like?
So the first software that I ever wrote was for creating T-shirt labels. You know, 50% cotton, 50% polyester, and that whole, and all the machine wash language. And you know, that takes a software to print out on a special printer to actually make these labels. So at the time, my dad was working on a project in his office, and I created a way to just make it all consolidated into one software. And part of it actually he didn't even ask me. I was just so curious about what he was doing, and I realized there was a way to make it better. Now the story goes, I was 8 years old. I was installing the software at my dad's office. It was 6 o'clock in the evening. Nobody was really there. And he steps away, and I'm installing this software that I just wrote on this computer, and a man comes down the hallway. It was the CEO of the company. And the CEO of the company was leaving late, and he sees this little kid. The first thing he says, "Hey kid, get away from the computer." So my dad overhears this and steps in, explains what was going on. And then he looks at me, he says, "Hey, you wrote this, really?" And I'm like, "Yeah." He goes, "Let me watch." So he watches me install it. He watches me test it out, run a whole program, print the labels, and he goes, "Huh." He goes, you did this. So he goes into his pocket, reaches out, and he took every dollar in his pocket. He had 3 $20 bills, $60. He goes, "There you go, kid." And at 8 years old, the first thought I had in my mind was, wait, you can get money for this?
That's where it all started.
And that got really exciting after that. Like, oh, you can get paid for that. So since then, that one company alone, since I was between the ages of 8 to 12, I was asked to do projects during the summertime, between classes, right? My summer times were filled with either both hanging out in the park with the kids and going to an office.
Writing code.
Right, actually going to an office, and I had a desk and everything. Between then, a software company in Staten Island actually picked me up as well to do projects on the side. I wrote software. I did a blood management software at 14 for I think Coney Island Hospital. I did the Data International. I mean, just some really big names, and a lot of them didn't know that it was a kid behind the software.
So you were a
being
kid behind the screen doing this work, this complicated work.
Yeah.
And these big executives didn't know they were dealing with a kid.
They had no idea. One did. It was actually a couple of times they actually came to visit because they had to really address some new project details, and they had no choice but to realize.
What was their response when they saw you?
There was always the shock factor in the beginning. I kept the business, and always there was a comment like, I have a kid your age, right? Or I have.
Why isn't my kid writing code for big companies, right? So how did you advance your coding skills? Did they train you in that, or how did that work?
No, in fact, I kept pushing my own agenda. Remember, this is the time. At the time, this was the 90s, and there was no internet really. There was no real way to actually get the latest thing. You had so many other ways to kind of keep up with what was going on. There were conferences. I mean, I remember when Microsoft and Visual Basic first came out, and it was the first time you went to Windows and the whole visual movement came in, and there was a training program. Everybody was an adult, and I must have been like 12, 13. And I remember going to the launching training seminar for this software. It's like a 2-3 day thing. And what do they have in those kind of events? Coffee and bagels, right? So what does a 12 or 13-year-old kid have when he started having coffee? I'm sitting there, and I'm like, my heart's racing. All types of chemical reactions are happening that I'm not familiar with.
Wow.
So these are my kind of experiences.
So were you learning this in the Philippines? You grew up in the Philippines.
No, I grew up in Jersey.
Jersey.
Yeah.
And being from the Philippines, so you didn't have any interest. When did you move to the United States?
No, I was actually born in California.
You were born in California.
Then we went to the Philippines when I was very young. When I was 5, 6 years old, we went back to the U.S. And
You've done a lot of good work in the Philippines. You've gone back and you've
Yes.
helped in many ways. Do you
Thank
want to
you.
talk about some of that?
Sure.
Yeah.
The experience that I had was when I was in my early 20s, I had a company, I had a real estate software company. And it was a national title company to help build cell towers around the United States. Did around 10, 15,000 towers a year. And one of the challenges that I had and one of the opportunities that brought me back to the Philippines was actually using it for outsourcing and developing a back-end operations. We were very young at the time into that space. I didn't realize it. I once spoke to a government official and said, hey, how did you guys do this without any government help? And I'm like, I just went back there and I set up an office. So I know what is outsourcing? What are you talking about? I was just trying to cut costs. But I started with job creation and building businesses over there that were part of my international type of work. I growing up as an American and going back to the Philippines for the first time, it's very much apparent how it's mixed with wealth and poverty all in the same bowl, right? So it's very clear how diverse and how integrated everything is. So you can't go there without first experiencing the good stuff along with the bad.
When you see a problem, what's your first go-to thought of how to fix it?
Well, the first thing is, I think people that have that inclination always want to fix something, right? I think nowadays, I've grown up and I have to ask myself is, which problem is mine to fix? Because otherwise, you can't get anything done. They have a saying, chase too many rabbits, catch none.
So learning that, how did you first learn that? Was it a trip and fall kind of experience, or was it an aha moment?
It was getting one thing done. And knowing to get one thing done meant something can get done. I think that there's a trap when we try to solve all the problems in the world and we don't solve anything. But when you do solve one, and in fact, I learned this at a very young age, it's about mastery, right? And the art of mastery to me is not about mastering a thing, or it's about mastering one thing. I think that if anybody ever learns to master one thing really well, it's the same thing for everything else. You learn how to see everything else because you didn't master the thing, you mastered yourself.
So did writing code at such a young age influence your ability to be a visionary where you actually see the cause and effect of your decisions and your actions?
No, I think writing code helped in having confidence that I can comprehend something, break it down, and even without knowing the answer, know that if I broke down a problem to its core pieces, the answers reveal themselves. But being a visionary isn't that. Being a visionary is desire. Yeah, if you have the confidence that you can find and see something, but the visionary part is wanting to see something. You want to care. You have to care in order to look for a solution, right? So I think when you talk about what visionaries are and how that helped, it helped build the confidence that if I cared, I could do something.
So caring is at the core of your company, AEVOLVE.
Yes.
So you had an experience that really jump-started this company, right? About your own experience going through healthcare systems. Talk about that.
I am the chairman and CEO of a biotech company called Amylex. And at the end of the day, when you talk about the challenges in healthcare, medical innovations, really solutions that actually will help people. I didn't see a problem, I experienced it. And the experience that I had was directly in what were the challenges that came to people trying to get real solutions out to the people. Now, medical is intentionally and deservingly difficult as a space. I mean, you're talking about releasing a product that's going to go into the human body, that's going to go into, that's going to say that it has a particular type of result. So these are regulatory challenges. These are things that governments have come up with and solutions to come up with saying, okay, we have an FDA, we have a process to undergo in order to prove out and make sure that what you say you can do, you can do, and that it's safe for the people to take. But at the same time, that's only half the battle. You see, there's a science of pharma, and then there's the business of pharma. And at the end of the day, I've become convinced that there are many scientists that actually go into this space knowing either two things. One, they have an answer or an idea that can help other people, or if not just for the people, if not for people, but just for the science for itself, that it can be progressed, that something can change. So there's already a desire on a technical and a genius level that's already there. But then once that manifests to a certain point, then practicality kicks in and says, okay, now money is needed at a whole new level. Now, the biotech sector in the United States, you're talking about 5,000 molecules and applications to one FDA approval. Your success rate is extremely low. At the same time, the entire process in the US takes around $60 million on average for a new molecule to hit its end stage. Now, if at 5,000 to 1, most big companies, what they'll do is they'll bet $1 billion, say $100 million per project, 10 projects, and hope one of those projects works. So they intentionally know that 9 will fail. That's a $900 million bet.
And how do the smaller companies compete with that?
And that's the problem, isn't it? Because unless you're part of their story, then you have a very low chance of success. Don't get me wrong, the beautiful thing about being a small company is you have a chance to be flexible, fast, and creative. But at the same time, you are fighting giants.
Seems like an impossible thing.
That's right.
And so,
that's right.
don't you think at this stage in our culture and the things that are happening in this world makes it very difficult for people to bring a product to the commercialization aspect where they can actually reach people? And money and prescriptions are just going up, 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 but yet the profitability of those companies are going down. So your platform brings a solution.
Well, actually, where did you hear the profitability was going down?
I thought I read that in your white paper.
For the big pharmas and the way they're set up, profitability only goes down when they lose patents.
Lose patents when they lose patents.
Yeah, when the patent expires, then it goes to generics, and sure, that's what they're scared of, right? But at the same time, there is the way commercialization happens is that you're looking for a lot of these companies are looking for financing, and financing usually happens with a pretty much distinct set of financiers in the biotech space. You can kind of tell who can do $100 million worth of financing, and at the same time, there's a line.
Get in line.
There's thousands in line for the same group, and most of them will only do 10 a year. And so that's a problem in terms of, does that mean that that project is actually not worth it? 85% of the NIH projects, even if they're of the highest class of project, are still unfunded.
So you have to create a platform that changed the financial system of the healthcare system.
So let's put it this way. You have a select group of people that actually make the choices for everybody. So for example, if you have a organization, a financial institution that actually says, okay, here are the projects that we will fund, right? If they deny a project that can save the life of someone that you love, they just made that choice for you. So what happens is they'll do it because they have certain criteria. You know, what's profitable, what's practical, what's going ahead, what's patentable, they have all these criteria. What can they resell, how much profit they can make. So profit's still there, right? The challenge is that the same value system that they have doesn't match ours. Their value system is what is the most logical to bring out to the market, what is practical. There's a practicality in terms of a financial drive. When a person has someone they love that's sick, that needs something, practicality goes out the window. It is need. Yeah. Absolute need, because it now is life or death. And there is nothing more practical than surviving. And so that's what we address. And what we believe is this. At the end of the day, these same gatekeepers make their money the same way as everybody else. They will sell this to the patients. So let's let the patients' value systems drive the financing.
So you put the power back into the patients.
Absolutely.
And then the patients decide what they want and how they want to fund it with your token system. Let's talk about that.
So there's different ways of how we've addressed this problem. And blockchain really is the only way to do some of these things. And that's why I'm so excited about using the blockchain platform, because the things I'm about to tell you right now, if you rewind back 20 years ago, this is a fantasy, right? So for the patients, what we're doing is we're allowing them to discover technologies, projects on their own through our platform. We will market, we will push to them. We will spend the tens and tens of millions of dollars in the beginning alone just to make sure that they find these technologies. They'll be in cancer, Alzheimer's, diabetes, rare diseases. Right now there are 7,000 rare diseases and only 5% have any solution to them.
So for people who don't understand blockchain,
yes.
how do you explain the use of it in this system? Because most people would say, well, why can't you just do that in the traditional healthcare system and make us, involve us somehow better without using blockchain? So what would you tell them?
In a very simple way. Let's say, I'll do a metaphor. How's that? Let's say you book a hotel room, and that hotel room is a year from now. Fabulous place. You spend thousands of dollars. You made sure you booked early, so you got the best deal. And 6 months later, your brother's having a wedding, and you got to cancel that. So you got to go to Facebook and say, hey guys, who wants to take my hotel room, right? And I don't want to waste it. It's worth all this money, and you're marketing yourself to ask someone to take over your reservation, right? Imagine that instead of having to go through all that pain, you book the room, you don't need it anymore, you press a button and somebody else grabbed it because they wanted that room too. You didn't think about it. You just pressed a button and it says, sell my room. Well, replace the room with a treatment for cancer. Replace the room with a treatment for Alzheimer's. Replace the room with a treatment for diabetes. What happened? Well, you, as the buyer, just got access and reservation to something that you need and desire for life and survival and living. Something can happen, and you're able to liquidate, so that you're actually you're financially protected. On the other side, the hotel, or in this case, the medical innovator, got the money they needed to get this thing commercialized. So in this very same process, those that needed something were given access, and the ones that needed the access, the ones that gave the access, got the financing ready. Help me help you, right?
I think some people might glaze over
yes.
as you try to explain to it. Blockchain is kind of like a ledger, right? So it's a ledger.
Sure.
Anything that can be ledgered, you can use
yes.
blockchain technology for.
Sure.
So in the digital age, when people's medical records are becoming digitized and we've transferred over everything, and there's a lot of distrust in that because hacking is a reality. Those sort of things are what the everyday person hears on the nightly news, and they get concerned. And so they're trigger words for people mostly. Blockchain, oh no, I think of the Bitcoin crash. And don't want to do that, right?
Okay,
and why would I trust my medical records with the cryptocurrency world? How do those two meet? How would you describe the necessity of those two coming together? So
well, first of all, remember, the word blockchain is synonymous with the word cryptography. And cryptography is security.
So AEVOLVE bypasses traditional funding and allows patients to have a say in the innovation, in the products. That's very different than what we have set up here in the United States.
Actually, globally, this is the most different thing ever when it comes to medical innovation financing. I mean, we probably won't bypass the system altogether right away. That'd be kind of impossible. But we definitely offer an alternative. And that alternative is actually enough to give leverage towards the voices that needed to be heard, which is the patients, for the medical innovators, the scientists, the researchers that need the leverage that they've always been looking for.
puts the power back into the people. And I know that's part of what inspires you to create.
Oh,
right?
yes. Well, it's social justice is one of my key drives. And is this not a balance type of approach?
How do you take on the subject of big pharma as you're, launching your company and turning it into something totally really different?
I'm going to give big pharma an offer they can't refuse. So the way I look at it is like this. When you talk about a platform that's going to be inspiring, consolidating community of patients and users, a movement-based type of feel actually, because they've taken on the casuals of their own health. They've made themselves responsible for their health by engaging on our platform. That is one of the best influencer network that any pharma could ever access.
So explain to me and to everybody watching this how it works exactly. You're a patient, you're coming on to your website. How does it work technically?
Sure. There's different ways that they can discover and identify things. It could be the news articles that we push out. It could be one of our apps that you can have access to. But at the end of the day, you're going to discover something that's relevant to you. Most likely a meme or a video that led you to our site that says, hey, I'm dealing with somebody that has ALS. I'm dealing with somebody that has diabetes or cancer. There's something going on here. The first step is on our site, you will learn about what's actually out there. More than likely, we'll be promoting a particular innovator that has something very exciting, very new. And the whole point of our platform is to make sure that you understand. So a big part of the technology is not the technology itself, it's communications. It's taking complex science and making sure that people understand and appreciate what's actually out there on context to the other things that are being said.
So you have a biosphere.
Yes.
That's on this system, and you take the patient and the product and the health professional.
Yes.
And you bring it all
Yes.
together in
So
a beautiful trinity, kind of set up this way for people. How is this new from what we have?
Well, right now, there's a lot of educational platforms that are out there for new technologies. Kickstarter, you want to go there and you want to learn something new, and they want to offer, you want to donate and get a new T-shirt for a new technology that's coming out. You can do that, right? It's the responsibility of every company to make sure that their technology gets out there. But technology companies, scientists aren't the best marketers, and they are not the best in communicating to the masses. Our job is to make sure that we consolidate the community so that the small researcher has the same voice as the large pharma.
So they can see the new products, see the new treatments available, and better understand what they might have access to.
That's the first step. The second step then is how you can participate. You see, these companies are also looking to get financed, but at the same time, what they have is valuable today. So the idea is for a patient to see what they have and say, oh, I want my child, I want my relative to actually be the first to access this technology. So they can actually purchase right there. Now, the concept of blockchain and coins and crypto, they don't have to worry about any of that. All of that is abstracted.
Would they worry about it? How do you get over the stigma that's associated with cryptocurrency thanks to Bitcoin and the crash?
As far as they're concerned, on our platform, they're seeing a reservation to a treatment.
So they have to just be open to it and go in?
Well, there's no real mention of crypto on the platform itself. It just shows you, it's called a coupon or a reservation to actually access a ALS treatment, et cetera. The only difference is the buttons, the features that you have. You can press a button if you don't need it. What's actually happening underneath all of it is a blockchain, engine that's actually performing all these transactions, that's just tokenizing treatments, that's allowing spheres and tokens to be actually exchanged. All of that is happening underneath.
So they don't have to buy tokens to be part of it?
Tokens are being purchased, tokens are being moved. The digital assets that are representing medical access are being actually transferred, but we understand that patients don't care about that either. We respect that.
I think it might actually make some people afraid, a little bit hesitant to do it because of the
people are afraid.
Public perception of cryptocurrency.
People are afraid to email before.
Most people don't know how their computers work.
Yeah.
Or their phones.
Do they
and
have
maybe
to?
they don't need to, right?
Yeah, I don't think they have to.
I want to know why you chose the Ethereum as your base infrastructure.
Oh, I get asked. I get asked that question along with why this blockchain concept, and I said to them something very simple. I'm not building the fastest contract. I'm not building the newest token to do some improbable calculation. I'm not actually using anything that sophisticated in terms of a new token that's technologically advanced. I'm taking the most basic Ethereum contract, and I'm just using what's there.
Why did you choose that instead of the Bitcoin platform?
It's because it works.
Because it works better?
It works fine. In other words, if the Bitcoin platform is the engine that you use, I'll use that. At the end of the day, it was flexible enough to solve this problem. If there's other solutions out there, there's other blockchains out there, et cetera, et cetera. But if you understand how I'm talking about this and how we're really utilizing it, I'm utilizing it for the functionality of tradability, digital asset conversion, inherent to every single one of those platforms. ERC20 is easy.
Does it have a different language?
They all do.
They all have their own language, right? Is that how it works? Yeah. So do people have to buy the AVEX token? I know I kind of asked you this already, but they do have to buy the AVEX token.
We have solutions on our platform that kind of streamline it so that they can think about it in terms of credit card or whatnot. But at the end of the day, there are going to be savvy ones out there. They'll find ways to get discounts using other exchanges to buy the AVEX token and whatnot. And keep in mind, there's also new opportunities that we have with regards to our listing in stock exchange in Switzerland.
So you've created a cryptocurrency that has value and something behind it, whereas most cryptocurrencies aren't really associated with some kind of value to it.
So that's a good question, actually. It's a good comment. Because a lot of cryptocurrency companies, a lot of blockchain companies, they are building a platform, they're building a technology, they're hoping for adoption by the industry. And they're hoping that by that adoption, more value is created, people will be drawn to it, et cetera. And the reality is that's not us. We are our own first client, number one, right? Because we come in with our own Alzheimer's and diabetic medical tech to actually launch the platform. But more importantly, blockchain aside, our drive is not to create the most sexiest blockchain tech. Our drive is to get solutions out to people, medical technologies to people, save lives. That's our drive. And so at the end of the day, the blockchain component is only part of the answer. The majority of this answer is reaching the people, having them understand this, providing them the engine with the blockchain backend to get these transactions going. But at the end of the day, there's a financial mechanism, there's evaluations. There's a whole engine that actually makes this more real. We want people to not just find these solutions, but we want these solutions to actually meet the expectations that they're claiming.
Do you foresee the token becoming a global cryptocurrency so that all these healthcare places can get online and everybody can work together to create better innovation worldwide for everybody?
I believe that our token is synonymous with a virtual country, and that virtual country represents the future of medical innovations. If you had a token to represent every innovation in Silicon Valley for the last 50 years, whether the technology failed or succeeded, that's a pretty valuable token. Well, this token is not Silicon Valley Electronics, it is going to be medical innovation, it is the mind of scientists and researchers. And these transactions that we're gonna see through this token, it's gonna represent things that are gonna be unheard of today, but the most practical thing tomorrow.
So you're really creating a platform where all of these ideas can come together and help.
Absolutely.
And the cryptocurrency part is an interesting thing. What about insurance? How does insurance work with it?
Well, that's the second time this week I get asked this question, and the second time I'm going to say that's coming up. I'll tell you when we're ready.
Okay, I got it. And you understand what the real problems are.
Yes.
And you're not changing who you are to accommodate the corporate stuff.
Yeah.
That most people do change for.
Well, you have to respect every profession and environment that you're going to work with, anyone that you're going to deal with. But at the same time, they should also respect you.
Oh, right, that.
That part too.
Yeah. Well, I want to talk about tracker certificates and get a little bit technical with some of your ability to be able to bring cryptocurrency to this place, because it really hasn't been brought to this place before.
Okay.
I don't think, anyway.
Good, good.
So explain what a tracker certificate is.
Okay, a tracker certificate is very similar to it's basically a security. A security that can be traded on a stock exchange. It can be moved around just like an equity piece would on a digital level. But at the same time, it's not necessarily equity or a bond. It's actually a structured product that we have that's tracking our token. So why is this so important? Well, when I started this project last year, there were so many new ICOs and new projects to launch. Everybody was all giddy-eyed and ready to make $1 bazillion, and everybody had the next hot thing. But I spent a decade of my life developing a technology, running through regulatory processes, investing millions of dollars, and at the end of the day, that technology was about to go out, and I was not about to risk our platform and all that work on a very risky regulatory environment. But at the same time, I love technology. It's my roots. And I believe that cryptocurrency, blockchain, that entire space needed a project like ours to enter in because it was real. It had real meat, it had real value. So anybody with real value would always be scared in an environment where the laws alone are fluctuating. I talked to lawyers, I talked to the SEC consultants, I spoke to how many people that claim to have the answer, and the worst part was they know nothing right now because we can see by the fruits of their work that they're all getting subpoenas. they're all getting caught up in the legal mess.
IRS is coming,
right?
Kind of thing.
So
well, it's real.
so the tracker certificate was a way around all of that.
So explain that.
So what happened was we said we're not going to ICO. We're not going to have this whole regulatory thing even come close to us. What we did was we took a security, which is a tracker certificate, is actually a known product, right, that you can use on an exchange. And imagine it kind of like a car title, a title to a car, and you can trade the car, right, with the title. So if I buy and sell a car, I'm buying and selling the actual title, right? Except the difference is it's on a stock exchange. Okay. That's a certificate. Certificate is like a title certificate, right? Except in this case, it's tracking our token. So what does this mean? Well, that means that there will be no question whether we are raising money through a security because we are raising money through a security.
So that's right? The difference between what your company offers and what so many of those other ICOs tried to do but couldn't do it successfully.
And on top of that, they're trying to change their story to STOs, which are security token offerings now. This is the newest thing. They're saying, oh, well, we're not doing an ICO, we're doing a security compliant token. So I say, but from the beginning, I always ask this one question. So a security token is a digital ID representing real world assets like an equity. A digital token representing equity that you can also trade on an exchange platform.
So before it was like an item, right? Or it would be a material thing.
Yeah.
I know some platforms that have done that, and it hasn't, it's been lukewarm.
That's right. But then they wanted to convert it to equity, right? Yeah. So imagine what equity and a digital token that could be traded in exchange. That's the stock exchange.
Which is Wall Street.
They already have that. So unless we're ready to actually create the licenses ready and pay for a whole new NASDAQ, then technically speaking, the STOs have a way to go. I believe STOs are the future, don't get me wrong.
So right? In a traditional investment, they'd go to a company that would help manage. They would pick kind of a generalized area or industry where they want their money to go into, right? And some people didn't even really know what companies, some people don't know what companies they're even really supporting that way. So they just know, well, I'm going to do biotech or I'm going to do military or whatever. And then they just walk away and they watch their 401k grow. Sure. So, but in your crypto infrastructure, you make the patient the owner and the stockholder who then gets to decide which projects get funded, which innovation. So you really have not only just created a system where people can find treatment, but now they can make that decision as to who gets funded.
And the currency between all of those transactions, between the patients discovering the need, purchasing that need, actually redeeming it and giving it to the innovators, that whole ecosystem is represented through that token. And so
blockchain, right?
And yes, through the blockchain platform. So that token that we're talking about, that's what's being represented in that tracker certificate on the exchange.
Which gives it its value.
That's right. So it actually has, so I also like to point it out that it's a different way to think about business. Now I think the future of MBAs will have this exact conversation that I'm about to tell you right now. Right now, when a company is being evaluated and you want to look at the value of a company on the stock market or whatnot, you look at its profitability. So they're going to have a quarterly earnings report, even a call with the CEO to tell you what's going on. That's the profitability. Let's say that's the end of the quarter, but at the beginning of the quarter, throughout the entire month, sales are happening, revenues are happening, customers are being created. Imagine that business line is represented through a currency, its own token that represents that economy. That means I can invest in the beginning of the quarter and get access to the revenue of the company's activity. The revenues represent the front of the company. The net profits represent the back end of the company. Now, could you imagine a scenario where a company can actually gain more value in the front and lose money in the back, and you net out positive? This is now possible with the concept of cryptocurrency. The net income of the actual company is the end. The currency is the front, that's the top, that's the beginning, that's the revenues that are happening. So you can gain exposure to your customer base, to your product line, and next thing you know, whether the company was managed well or mismanaged, there's still value from the front, and you can now have companies that can be true NGOs, true nonprofit organizations that are now gaining still value because they have a currency that represents their activity, their value from the top. What does that mean? Companies will now focus on their community better. They'll focus on the consumer better because they know that there's still value, not just in how many profit points that they save, how much earnings they increase, how many costs they cut. It's about how much value they want that they give to their customers, how much incentives they give, how much attention they give their consumers. That's going to be the new economy. So cryptocurrency, through this model, will actually fundamentally change the way we operate business because it now balances it out. It's not just the net income bottom that's going to be necessary. That's going to be the true determining value. It's going to be the front, and the front is people and transactions.
So are you then, in a sense, changing business model, the business model?
I actually didn't change it. I'm just highlighting it.
You're pointing it out.
I'm pointing out that this is what's possible, and this is what we're doing.
And here's the problems.
That's right. Because at the end of the day, we don't have to point out the problems anymore. We already have a solution that's possible to take this thing to the next level. This blockchain. We have a solution in medical right now, which is what AEVOLVE is. We're leading by example. That's all we can ever do.
I'm going to go to this topic. Vaccines is a big topic in this country right now.
Let's go.
How do vaccines play into your company model?
Okay, so what are vaccines? Vaccines are solutions that actually use your own body to try to solve and reject or react towards foreign bodies, right? Gets you acclimated to actually prevent these from becoming an issue. Vaccines have been said that they're causing all these other problems. It's causing autism, it's causing all these neurodegenerative diseases, et cetera, and now people don't trust vaccines. And more people are getting sick. We have polio cases, for Christ's sake, coming out.
Well, the vaccine schedule has changed a lot since
Yes.
back in the 70s when I was a kid. There was like maybe under 25, I don't know the exact number, but there was a lot less than what you have to do now. So the argument is, why do we have to get so many more vaccines now versus then?
Well, I think it's because we know there's a lot more problems now. Over time, we've identified a lot of new diseases. I think how they play a role in our system is that if the innovation is true and it's worthwhile, then the people will know about it. If there are solutions that replace vaccines, they'll know about it.
Will they have a say in how it's produced and what's put in it? Will there be transparency with your product bringers that say they have a vaccine they want to put on your platform and they want people to take a look at it? How much transparency do you offer in ingredients and so on and so forth?
Well, any provider on our platform will have the requirements for transparency as they would in any regulatory scenario, just because they can't be commercialized unless the FDA approved them, right? So they've already gone through this process. But at the same time, the people will vote with demand. That's the bottom line. So how they influence things, the job of our platform and the job of these companies is to communicate the best they can to the average person so they understand. We invite medical professionals, scientists and researchers to comment. We actually pay them through the system to make sure that they comment. Instead of commenting in a scientific way, their job is to comment on these technologies in a very simple way.
Conflict of
that people
interest,
don't.
do you think? Or is it necessary for people to see, to make them involved in commenting so that people understand the full perspective
Sure.
of that? Yeah.
Well, they do that right now, right? Scientific journals and publications pay researchers to evaluate technologies. That's how we get papers to be reviewed. This is called a peer review. But the problem is when they peer review in a highly scientific level. They're commenting for scientific review purposes. The only difference is we're incentivizing them to review and make it English.
So people can understand.
That's it. That's the only difference.
So there's
We're doing
more
this now.
communication. There's more. You're open. It sounds like it's an open thing for people to come in and say. Now let's talk about the wallet system that you have for your platform. It's set up so that people can vote in their wallet. Do I understand that correctly? They use their wallets to vote somehow, or explain that how that works.
Actually, it's set up so that the people can hold the token and also retain the vouchers that they have for medical treatments. So from this wallet, they're basically just holding their future reservations. The key thing about these reservations is that it holds in escrow the original tokens and the amounts. So the reality is if something folds, if one of these projects completely just vanishes, they get 100% refund.
So there's a backing. So you back what's in there, which is really good. That's different
Digitally.
too. Yeah.
Yeah.
What about passwords to get in? Do you do special keys to get in if someone loses their password? I'm a millionaire somewhere, believe it or not. I just lost my
That
password to get into it.
Is it a laptop
That's
in a
a true
landfill?
story.
Oh
It's a
no!
true story.
Oh no!
So let's talk about that. So if somebody loses access to their wallet,
Yes.
is there a recovery system put into place?
I think, well, the answer is we have the fundamental setup right now as most exchanges and blockchain companies have set up for the regular access. However, we also recognize the fact that these are patients that are trying to access this technology. So there's going to be more of a customer service role that we'll put in front to actually allow for recovery, because I think that we're definitely going to run
I
into a
think you
problem.
need it.
Yeah, we need to.
Somebody needs a customer service person.
We need to
help
abstract this
with
so that they're not feeling very hard and very threatened by the whole blockchain concept. As much as possible, biospheres will try to eliminate the blockchain conversation. But at the end of the day, they will have a new generation that understands it so well that they'll find ways to get deals out of this
So
thing.
they'll be calling their kids on how to use this, and the kids will know because they're being hardwired for
I'm sure.
this kind of stuff, right?
And
We're in a new age,
in
really.
fairness, if somebody knows how to use the exchanges better and can trade our token somewhere else, they'll get better deals.
So you are on the Swiss exchange. So what does that mean for someone in the United States? Like, what is that?
So when we launched this technology, and part of our financing, we are launching in the Swiss markets for what we call the tracker certificate, right? And that actually helps to raise the first $100 million as part of our project. But in terms of the cryptocurrency world, we are launching on a cryptocurrency exchange. Does it concern them? Sure, because they're going to want to see what the stock market is doing with regards to our token. But at the same time, they have their own community to trade with.
Talk to me about how that began and what that actually is.
Okay, so BetaClear is a very unique technology. It's a nanomolecular technology. It's synthetically produced. And what it does is that it actually binds to a protein in the body called beta amyloids. Beta amyloids are a byproduct of our cells' manufacturing process. It's manufacturing proteins all the time. It doesn't get it right all the time. So what happens is it cuts these proteins in the wrong place. And you and I, normal, everyday, everybody usually just removes these beta amyloids as part of body functions. You sweat it out, you urinate, it just comes out. But once in a while, you produce a little bit too much, or there are people that have a proclivity to actually to produce too much. And what happens is they begin to stick to one another. When they begin to stick to one another, they're called oligomeric formats. These oligomers eventually, we found that they land in the brain, they become plaques, and they say this is Alzheimer's. But what we've discovered is that when they're still floating in the blood is when they cause the most damage. You see, they compete with insulin receptors. They actually start scarring. They actually, imagine like little knives floating through your body, through your blood system, and damaging multiple things as it passes along. So these beta amyloids, when they're affecting brain cells and they're killing brain cells, it's called Alzheimer's. When they're getting stuck in the lens of your eye, that's called cataracts. when they're actually part of your, when they're affecting your sugar levels and whatnot, because they're interfering with insulin receptors, it's type 2 diabetes.
Well, that's a big part of the population.
Yes, it is.
So they have protein issues, then it sounds like.
These beta amyloid proteins, what they're doing is they're actually, they're stopping the cells from performing their normal function. Instead of creating an antibody or developing a solution that actually is taken as a pill form.
You have discovered that this protein is what causes a lot of this disease.
The pathology of this protein, beta amyloids, has been known for a very long time. But what has changed is when it actually does the damage. You see, for the last 100 years, when it was first discovered, they were saying, hey, look, the beta amyloids are in the brain. It must be the beta amyloid plaques. But then over the years, they realized, hey, there's different stages to this thing. It's actually even earlier on. The symptoms of Alzheimer's actually appear 10 to 20 years after the first actual events start happening in your body. So what is that event? What we've identified as the oligomerization buildup of these beta amyloids. So it's already happening. So when we do a study on type 2 diabetes, when we actually start looking into that space as well, we believe that we'll be able to identify type 2 diabetics, and at the very least, make sure they don't get Alzheimer's, because over 60% of Alzheimer's patients are type 2 diabetic. I'm sorry, 80%.
Oh, it's a lot. It's a lot.
It's a very lot.
So now this isn't a medication.
No.
This isn't a vaccine. This isn't something that you put into your body.
It's actually a medical device.
And so can you explain how that works?
It's very simple. We utilize a known technology called dialysis, and we modify it in a very special way, but very simply, and we introduce the compound Beta Clear into the machine, but it never enters your body.
Well, it's based on nanotechnology, correct?
Yes.
So how can you ensure that something that small doesn't continue its way into the dialysis process?
That's part of our FDA approval process, and part of that research.
Company secret.
And part of that safety. No, it's published. It's actually known that the molecule that we have is just too big for the holes.
So it's not quite small enough to get into the next stage of the dialysis.
That's exactly how it was designed. Designed too big to come in, and the beta amyloids are small enough to go through.
So when a patient comes and they get hooked up to this machine, and they do it like a normal dialysis session, right? How soon do they start feeling better?
That one is to be discovered still, in terms of how we evaluate the full impact of its efficacy on the disease itself. What we claim right now is the ability to remove the beta amyloids. In other words, we do toxicity reduction, and that's one of the biggest claims that we have at this moment. But at the end of the day, the research for its full impact, it'll take years to actually truly discover. When it comes to Alzheimer's research, I have to make sure that I can prove that you don't forget something.
Like your memories, like your memories.
Like your memories.
So I want to talk to you a little bit about that. Now, all this technology is a lot of responsibility. Everything you've done is a great responsibility.
Okay.
So how do you stay grounded and keep your conscience at the front line and stand in your integrity?
I think integrity, that's the easy one. You just have to choose to do that. But keeping your sanity, that's the hard one, because you're talking about very difficult projects. The projects that we're talking about right now, tackling an unmet disease, a multi-billion-dollar disease like Alzheimer's, one that's been chased for a long time, diabetes as part of our pathway as well. Developing a platform to enable companies to challenge the current financial institutions that are the most powerful in this world. And you're talking about biotech and pharmaceutical companies which make billions and billions and billions of dollars a quarter, right? We're talking about those kind of companies. And we're finding ways to actually give the very pathway for their growth another chance, another opportunity to come to life which could compete with them. How do I keep myself sane with all this? That's okay, it's not my project. See, the way I see this thing is that any type of move like this, these are inspired by things beyond myself. And at the end of the day, the only way for these things to work is for me to remember that I'm just part of the story.
Stay humble.
Stay humble.
Are you a spiritual person?
I like to think I am.
Talk to me a little bit about how your spirituality has played a role in all of this.
I think that's what's kept my sanity. So I think that when people have projects that are, well, myself, I've had projects that are very, very intense. They've always been beyond me. And I've chosen those projects only because I felt the calling, right? I built the butterfly house that we talked about earlier on. Those are motivated by a need. I cared, I wanted to do something. I guess you could say that's a spiritual thing, but I believe in God, and I believe that He calls, He chooses, and all one ever has to do is respond.
So it's a calling, and you see the need, but most people stop there and maybe go post it on social media and complain about it. But you actually take it to the next level.
Well, yeah, that's great, right?
where it's like, okay, well, I just created this huge company and I'm gonna cure Alzheimer's disease.
I think I'm lucky because when I grew up, we didn't have social media to complain on.
Well,
So
I'm one of that generation too, so I could relate.
I guess I had to
that.
do something,
You went
right?
outside and actually enjoyed nature.
Nature, yes, yes.
Well, we've talked about a lot. You know, we've gone in a lot of different directions, and so to wrap this all up, what would you say is your bigger vision for all of this? I know we touched on it a little bit, but you know, to end it up, where do you see all of this going? What's your bigger vision for it,
So
for
the
the
big-
technology?
The big vision for this project is actually what drives me right now and every day. You see, I had a vision, and that vision is I imagined a child with a disease that I've never heard of, and a solution by some scientist and researcher that I've never seen yet. And I know that this future event will come where she or he, that child, will be met with a solution, and there'll be relief to this family. I will save the life of a person I'll never meet. And this is exactly what drives me, because I can't wait, and I'm excited by the very thought that there were things that will be put forth on this platform that I've never ever seen. I could not even imagine today what they are. And the lives and those children, those people that will actually find and thank God that this was ever done in the first place. And I know that I'm doing that today.
Well, thank you.
Thank you.
For following the call and for showing up.
Thank you. Thank you, Hillary.